Hello friends, today we are going to discuss regarding dyslipidemia. Dyslipidemia is a silent but major cardiovascular risk factor. Early detection, risk stratification, appropriate pharmacotherapy, lifestyle modification can significantly reduce morbidity and mortality. Now coming to its definition. So dyslipidemia is abnormality in lipid metabolism that results in elevated cholesterol, elevated triglyceride level, and low HDL level. Now coming to its significance. Dyslipidemia is a risk factor for atherosclerosis. It predisposes a patient to develop stroke, cardiovascular disease, or renal failure, or peripheral vascular diseases. Now coming to its type. It can be primary, which is primarily due to genetic cause, or secondary, which can be related to lifestyle, drugs, and diseases. Now coming to classification of lipids. So first, hypercholesterolemia. In this, there is elevated total cholesterol. Second, there is LDL or bad cholesterol that promotes atherosclerosis. Then there is HDL or good cholesterol that is protective. Second, hypertriglyceridemia, which can be associated with pancreatitis or metabolic syndrome. And third is lipoprotein A, which is a genetic risk factor for CAD. Now coming to classification of dyslipidemia. So first, hypercholesterolemia. Hypercholesterolemia, there is increased total cholesterol level and LDL level. It can be due to familial hypercholesterolemia, diet, or hypothyroidism. Second, hypertriglyceridemia. In this, there is elevated triglyceride level. It can be due to alcohol, diabetes, obesity, or familial hypertriglyceridemia. Third, mixed dyslipidemia. So in mixed dyslipidemia, there is elevated LDL level and triglyceride level. It can be seen in metabolic syndrome. Then fourth, low HDL level. It can be genetic or due to secondary causes such as lifestyle related or related to certain diseases. Now coming to causes. So primary is due to genetic cause. Secondary can be due to lifestyle related. For example, sedentary lifestyle or excess fat intake. Second, certain diseases. For example, diabetes mellitus, hypothyroidism, chronic kidney disease, and nephrotic syndrome. Then drugs. So drugs may include steroids, beta blockers. Now coming to clinical features in a patient with dyslipidemia. So it is often asymptomatic in patient until patient develop cardiovascular complication. But in few patients there may be certain signs. For example, xanthomas, xanthelasma, or corneal arcus. So what all lab investigation do we need to get done? First, fasting lipid profile level. Second, serum lipoprotein A in certain individuals who are high risk individuals. Now coming to interpretation of lipid profile report in a patient. So coming to total cholesterol first. So ideally, a desirable total cholesterol level should be less than 200 mg per dl. It is considered to be borderline high if it is between 200 to 239 mg per dl, and it is considered high if it is more than 240 mg per dl. Second, triglyceride level. So triglyceride level desirable range should be less than 150 mg per dl. It is considered borderline when it is between 150 to 200 mg per dl, and it is considered high if it is more than 200 mg per dl. Now coming to LDL level. The desirable level of LDL should be less than 100 mg per dl. It is considered borderline when it is between 100 to 159 mg per dl, and it is considered high if it is more than 160 mg per dl. Then HDL cholesterol. So it is normally more than, desirable is more than 40 mg per dl, and it is significant when it is less than 40 mg per dl. Thank you.